Hi everybody, this is Dr. Manoj Bhardwaj here with Bhardwaj Health, and I just want to take a few moments of your time to explain our bioidentical hormone replacement therapy procedure. It's a pretty simple procedure. It takes only about 10 to 15 minutes. These pellets are inserted under the skin, so it's a subcutaneous procedure, and it's usually done on the left or right buttocks depending on the patient preference. So first thing is we bring the patient in and we have them laying down on their side, the left or the right, depending on which side we're doing. Once they're in position, we use some betadine, clean the area up, create a sterile field. Then we draw up ample amount of lidocaine and some bicarb. Some people can experience some burning with the lidocaine, and to negate that effect, that's why we use the bicarb. Once that's in and we let that settle in for a few minutes and the patient's super numbed up, that's when we make a tiny incision. And we insert the pellets using what we call a trocar and cannula. This is an example one right here. And I wanted to show you the size of these pellets. They're super small. This is an example of a male testosterone pellet. The one that we use for women is slightly smaller than that. And this is the example of an estrogen pellet. Again, super small. You can barely see it. And again, these are inserted using that cannula, and once that's done, we remove the trocar and cannula. We put some Steri-strips, a sterile dressing in place, and we cover that with an ice pack. This helps to mitigate any kind of discomfort or inflammation they may experience, and the patient goes home with that. And we usually recommend, no soaking in hot tubs or swimming pool for the first week. No heavy lifting or any intense workouts which involve the gluteus muscles. And after 1 week, the entire dressing comes off and people can go back to their normal lives. And again, thank you for your time. This has been Dr. Manoj Bhardwaj here with Bhardwaj Health.